welcome all to today's episode, and I am proud and thrilled to introduce with us Dr. Aniruddha Gokhale, highly respected urologist and surgeon with over 20 years of practice and over 17 years of specialization in urology and andrology. Dr. Gokhale has his own private practice in Borivali West near Don Bosco School and also in Kandivali East in Thakurvili. His expertise spans a wide range of areas including treatment of urinary stone diseases, managing genitourinary cancers, addressing prostate conditions, and performing complex reconstructive urology surgery. His commitment to excellence in urological care has earned him to prestigious Eagle Traveling Fellowship. He has also made significant contributions to the field through numerous presentations at major conferences all over India as well as abroad. Today, we are excited to dive into his journey, hear some insights about his vast experience, and learn a lot about evolving field of urology. So, welcome, Dr. Aniruddha, to my show.
Thank you, Dr. Vishal, for having me on this show.
Thank you for joining us. We will have a few series of questions with you. We will like to know about your field, your past years of experience which we had in your particular field. So my question comes here for you is recent advancements in urology. A lot of people are talking more about robotic surgeries in urology. So as a urologist, do you feel robotic surgeries in today's date are a boon for human mankind? And what are the pros or cons of introducing robotic surgeries in urology practice?
Yes, Dr. Vishal. First and foremost, I would like to say that the robot in surgical practice, be it urology or any other branch, is now here to stay. Previously, people thought that robots means something, a machine which will come on the human body and operate on the human body automatically and then move away. But it is not the case. It is a robot operated by the surgeon himself who sits on a console, and there is only a robotic arm which is under the command of the surgeon which does the surgery. The main advantage of the robot in urological practice is in cancer surgery and in complex pelvic surgeries where access by open surgery becomes very, very difficult. It is a boon for the patient definitely in reducing the morbidity, in improving the outcomes of surgery as regards cancer care and the overall health benefits of the patient. Because the robot itself is such a beautiful tool for surgery, I think people should opt for it, and the urologist should offer them the robotic surgery whenever indicated.
That's really nice input you have given about robotic surgeries. My second question comes to you is as you are andrologist as well, a common factor or common complaints in today's date is impotency and infertility, and especially male erectile dysfunctions. I come across many patients coming with these complaints of male impotency. So I would like to know more from your end that what is the significant increase happening in the past 1 or 2 decades with this particular complaint, and how much of them are psychological or stress induced, and how much of them are really neurotic, and is there a cure for this as well?
Yes, that is a very good point, Dr. Vishal. Actually, the incidence of male impotency, as you rightly said, is on the rise these days. However, I would like to differ here. The incidence is not on the rise. In fact, more and more people are now opening up about the issue more freely to his doctor. Erectile dysfunction was always there, but however, because of social factors and other factors, people were very reluctant and shy to approach the doctor. Also, there was a big question as to whom to approach in case of such problems, because these are the problems which cannot be discussed openly amongst friends, amongst colleagues, and even sometimes they don't know whom exactly to approach for male impotency. That is why here the role of the urologist comes into the picture, who is the right person for treating male impotence. Now, coming to the factors causing male impotence, these days, given the hectic lifestyles and schedules, there is a lot of stress amongst all the working class men as well as the others, which will obviously result in some amount of male impotency. However, the major cause of male impotency still remains an organic causes like vascular causes or some neurological causes because of some neurological diseases, cerebrovascular accidents, etc. The important thing to note here is majority, that is more than 95% of these causes are easily treatable on an outpatient basis, and the others, more complex problems, have their own solutions in form of intracavernosal injections or nowadays excellent implants are also available in patients who fail all these other conservative line of treatment. So my advice to all the people out there is ki do not shy away from your problem, be open about it, approach the correct doctor and get yourself treated.
Absolutely, absolutely well said, Doctor. I'm really aware that still there is a little bit of taboo in a country like India, and that is the reason all should be opening up with their fellow doctors and share their problems. And there is 100% cure on that. That is really like nice to know on this. Great to know about this. Another question comes into my mind that since you have seen for past 20 years how urology per se has evolved, what is your comment on this evolution in terms of benefit for the patients in process of the surgeries, how easy the surgeries have become, how cost effective they have become, how is the morbidity or the chances of complications got reduced. So what is your experience in this past 20 years in urology field?
Yes. So the thing is that everything is evolving. As in everything, even urology has evolved in the past 20 years. Previously, the common urological problems like stone, prostatic diseases, or the cancers, they were a little bit difficult to treat. However, with time, we have got excellent medicines, the oral medicines, the drugs to take care of the problems. Majority of the problems can be tackled even without surgeries, and in patients who do require surgery eventually, like in complex stones, bigger stones, or prostatic diseases or cancers, these patients are likely to require surgery in the future. The thing nowadays is a keyhole surgery or minimally invasive techniques for a surgical tackling of all the urological problems. The major advantage of this is quick recovery, less morbidity, and quicker return to work in the patient. Other advantages are less of blood loss, which results in less weakness, less morbidity, and the cost effectiveness because the patient stay is reduced, hospital stay is reduced, other medicines, requirement of medicines has gone down. That is why these surgeries become very, very cost effective in the long run. Any problem requiring a surgical approach, we should opt for a minimally invasive technique as opposed to the traditional open method which were described previously.
So we'll come to the conclusion of this video chat. It was absolutely insightful to know about urology as a stream and your total journey of urology. I would like to understand that what would be your guidance for upcoming budding medical students and passed out graduates that when they want to opt for urology, how do you see 20 years down the line? What advancements in urology can someone think about which can really benefit a budding medical professional to enter into this stream? Second question will be in this that can anyone look into expertise in the super specialization as well, maybe in India or outside India, to tackle niche practice in urology? So, can you just guide me on that as well?
This is a very good point. The thing is, as we have already discussed, urology is constantly evolving. And in fact, we now have a subspecialty even in the field of urology. There are various
Right.
subspecialty like purely stone diseases, urologic cancers, female urology, male urology, and andrology, and so on and so forth. So my advice to the juniors or any newcomers who is entering into the field of urology, so after getting a basic training for about 3 to 4 years, the person is now more likely to subspecialize in a subject of his interest, and this is going to be the way forward, looking forward for the next 20 years. We will have specialists treating very specific diseases, which eventually are going to translate into improved patient outcomes and excellent results.
It was really healthy talk on your subject. And thank you so much for giving your valuable time to us. I know you are pretty occupied the entire day.
Thank you.
On
In
my
fact, thank
special
you for having me on this show.
yes, yes. So I'm really happy to get you into this show. I'm sure the topic which you have cannot be completed in this one single show. So hope after we get good reviews from our followers and the visitors of this channel, if there is any special questions from their end, we hope to have another session with you on this
Definitely.
particular topic.
We'll be looking forward for it.
Thank you so much, Dr. Aniruddha, and have a nice day. Thank
Thank
you.
you. Good day.